So you have the two Jessicas today speaking to you. So we'll get started. Our outline today is to review the basics of the ketogenic diet, talk about potential hidden sources of carbohydrate, potential benefits and contraindications to the diet, as well as some other more liberalized forms of the diet. So yes. Are you okay with it? I'm okay. All right, record ahead. So the diet, we're actually coming up to our 100th anniversary of using the ketogenic diet for epilepsy patients. So using it as another form of a medication, if you will, to treat intractable epilepsy. The ketogenic diet uses, it's a diet where you're restricting carbohydrate and increasing majority of your calories coming from fat. When your body burns fat as fuel, it produces ketone bodies. That's where it got its name. And this diet has been shown to be effective in infants all the way through adults. So for a little perspective of where your calories are coming from, we have our American diet over here on the right-hand side, and you can see majority of our calories are coming from carbohydrates. About 60% of your energy requirements are carbohydrates. Compare that to the classic ketogenic diet at the highest prescribed level, 90% of your calories are coming from fat. So majority of calories from fat, and you can see it's restricted in carbohydrate, and even the protein appears restricted when we compare it to the Americanized diets because we consume a lot of protein in our diets. We do provide enough protein for adequate growth and development for our children. So the classic ketogenic diet is prescribed. You'll hear what's called ratios. So either your physician or your dietitian will prescribe a certain ratio for you or your child, and it will be anywhere from a 1-to-1 all the way up to a 4-to-1 ratio. And you might see half increments or quarter increments, but what the ratio means is it's comparing the grams of fat compared to your carbohydrate plus protein. So at a 1-to-1 ratio, you'd have 1 gram of fat to every 1 gram of carb plus protein, and it's just the way that the dietitian will calculate your macros, if you will, components of your diet. So for an example, we have up here a 1,000-calorie diet, and so you can see at the bottom a 1-to-1 ratio would provide about 60 grams of carbohydrate for a 1,000-calorie diet for a child. And as you go up in the ratio, you can see how restricted the carbohydrate will be. So at a 4-to-1 ratio in this example, providing only 8 grams, and that's per day. So to put it in perspective, a medium-sized apple is about 20 grams of carbohydrate. So you can see how restricted in carbohydrate this diet can be. We have pictured here the avocado, naturally a 4-to-1 ketogenic diet ratio, and so as dietitians we like to use avocados quite frequently on the diet. This is looking at the ratio advancement by pictures. It gives you a nice visual of the food components, and so each of these meals actually provide the same amount of calories. So you can see starting in the green, a 1-to-1 ratio, you have some chicken breasts, some broccoli, and you have some aioli or mayonnaise. And then as you advance the ratio, you decrease the amount of protein. Again, still providing enough protein for adequate growth and development, but the protein does decrease as you advance the ratio, as well as the carbohydrate. So you can see at the 4-to-1 ratio, or in that red circle there, you have a very limited amount of broccoli, so that's where your carbohydrate is coming from. And then you have an increase in the fat source. So you can see the syringe of oil there. That doesn't necessarily mean that we would syringe oil into our children's mouths, but I think for the picture of this pictorial here, it just gives you an example of how much fat is included in this diet. This is another meal example of a breakfast that a child might have on the ketogenic diet. We have our protein with the eggs, the scrambled eggs there. Our carbohydrate is mainly coming from the strawberries. And then on the top, you have all your different fat sources. So we have our avocado, we have heavy cream, and we have butter. And so if I were to provide this for a child, I wouldn't serve it in this way. That I would actually incorporate the fat, the heavy cream, and the butter into the eggs before I cooked it. So it'd be absorbed into the egg and would appear to be a pretty typical breakfast, wouldn't you think, with the strawberries, the eggs, and then avocado. This is another diet example of maybe a lunch or dinner where it's a play on a stir fry. So I'm sure, show of hands, everyone's heard of cauliflower rice by now, seen it in the grocery store. And so this is just taking a play on rice using cauliflower. And then you have your chicken breast for your protein, your vegetables are providing the carbohydrate source, and then you can saute it in the oil. So the classic ketogenic diet is actually prescribed in grams. So each food component is given a specific gram amount and calculated by your dietitian. And so you would be taught how to weigh and prepare these meals using a gram scale. So this is the example of that eggs and fruit picture that I showed 2 slides before, where you would have 35 grams of heavy cream, 52 grams of strawberries, and so forth. And so you would prepare this meal using this recipe by gram serving amounts. This is just showing an example of how calculated this diet is. This is what your dietitians are using, or sometimes we teach our families how to use this web-based program to calculate each meal. And so this is a computer program where it has a big database of different foods. And on the bottom there, you can see it's calculating the macronutrients of each food item with your fat, your protein, your carbohydrate, the calories of the meal, and then getting your ratio. And so you can increase and decrease the amount of each food component to meet those goals.
The modified Atkins diet is one of the variations of the ketogenic diet. Unlike the classic ketogenic form, which is, as you noted, was quite formulaic, this one is a variation that does limit net carbohydrates, so it is significantly low in carbohydrates and high in total fat, but you eat foods as ad lib, so it's a bit more laissez-faire, I guess, a little bit more open. You get to have a lot more choices on this diet. How the classic ketogenic diet and the modified Atkins diet are similar is they are very low in carbohydrate and high in fat. The outcomes are very similar as well. So the main goal is to produce ketones and to improve seizure control. The difference is it's less strict. The restriction of carbohydrates, so for children and adults, the net carbohydrate can be anywhere from 10 to 30 grams daily. They don't have to be eaten all at once, or they don't have to be eaten kind of evenly throughout the day. They can be eaten all at once if you choose. You can have meals as a family and just add additional fat to it. And instead of using a gram scale, you can use household measures such as measuring cups, measuring spoons. So you are not dependent on a gram scale. Again, this is just a way to visualize the differences in the classic versus modified Atkins diet. So as you can see, the modified Atkins diet is still a high-fat diet. So instead of about 90% of your calories coming from fat, it's about 75%. There is quite a bit more protein in the modified Atkins diet because we are able to eat foods ad lib, or as you would desire. If you do eat too much protein, however, it can actually kick you out of ketosis. So it's something to take into consideration. This is not a high-protein diet. It remains a high-fat diet. So one of the differences is less strict, such as the preparation. You can do family meals. I realize this is a little hard to see, but this is a family meal you can prepare. It's enchiladas stuffed peppers with chili verde sauce. So you use 6 poblano peppers, ground beef, and you use household measures to measure this out. And then you can proportion it to each of your family members. So this diet can be a lot more inclusive than the classic form of the ketogenic diet. So this diet, unlike the classic ketogenic diet, where the dietitian, again, uses the computer-based program to prepare meal plans for you, this is a lot more autonomous. You have a lot more choices on this diet, but it does require you to count carbohydrates. So unlike the Atkins diet, where you use net carbohydrates, which you subtract dietary fiber and sugar alcohols from the total carbohydrates, you just subtract dietary fiber. What this allows you to do is to actually, you get more bang for your buck, essentially. So for instance, these Mission tortillas, it's a little pixelated, I apologize for that. The total grams of carbohydrates is about 13 grams per soft taco or soft tortilla. The dietary fiber is 9 grams. So you would subtract the 9 grams from the 13 and you would have 4 net carbohydrates for this one tortilla. That's actually pretty good, and I really use these tortillas quite a lot in my practice. What I also like about these tortillas is they taste like good flour tortillas, which is not, you cannot say that across the board of even whole wheat tortillas. While you can eat foods ad lib, or as you would desire, I really recommend using household measures to measure out carbohydrates, because sometimes eyeballing it, I would like to say that we can do that really well, but it gives us a little bit more, if by chance the diet is not working as you might expect, it gives us a little bit more opportunity to fine-tune the diet for you if you use household measures and count carbohydrates pretty strictly. What the modified Atkins diet does allow you to do is to more easily dine out versus a classic ketogenic diet where you are highly dependent on a gram scale. So you can make small modifications at restaurants. So the simplest I can think of is just a protein-style hamburger. All you have to do, you can actually ask that anywhere you are now, is for a protein-style hamburger. I remember when I first started this, asking for a protein-style hamburger outside of In-N-Out Burger was kind of unheard of, and this was, 5 years ago. It wasn't that long ago, and now you can really get one anywhere. You can easily do salads, which I know is not the most exciting thing for children, but you can pick off the bread of chicken tenders and stuff like that, and use mayonnaise as a dipping sauce. There's a lot of ways to be flexible on this diet and to remain that social aspect of eating. Now we have all of these different types of diets. Jessica previously talked about the classic ketogenic diet. I mentioned the modified Atkins diet. There's also the medium chain triglyceride and a low glycemic index treatment, 2 other variations of the ketogenic diet. Again, both high in fat, low in carbohydrate, and the main goal is for seizure control. Now in practice, each of us, dietitians, physicians, we might talk about each of these diets, but in practice, what we as dietitians might do is mesh the principles of all of these together to make it work individually for you. So it's not a one-size-fits-all diet. We try and make this work for you. So that's why I like to use an umbrella term. So this is just an example of macaroni and cheese at a 3-to-1 ratio, as Jessica mentioned before. So there's 3 grams per every 1 gram of protein and carbohydrates combined. And this just demonstrates the flexibility you can have between using a gram scale, or you can use household measures in this case as well.
So if your child is tube-fed or needs an oral supplement, there are some commercially available ketogenic prepared supplements pictured here. So we have KetoCal made by Nutricia. We have Keto V by Cambrook, come in a variety of different flavors, and we can use those as complete nutrition for tube-fed children or as an oral supplement to help supplement their diet. There's also a soy-based formula called Ross Carbohydrate Free, or RCF, pictured in the can. And then we also can do whole food blenderized ketogenic formula. We use that often for our kids that might have vomiting or diarrhea, constipation, is using whole foods to provide that blended diet through the G-tube. Now to decrease the ratio, if we need to increase protein, we can provide some protein modulars. We can provide something as simple as cornstarch to adjust the ratio depending on how the body is producing ketones. And then we can increase the ratio by adding some different fat modular products. So MCT oil, you'll hear quite often on the ketogenic diet, as our body metabolizes MCT oil compared to something like corn oil or avocado oil, actually produces more ketone bodies per gram. And so we do use this quite often on the diet as well. So I'm a firm believer that there is a ketogenic or modified Atkins diet alternative for almost any recipe that you're currently using in your child or yourself's diet. And so we can celebrate holidays on the ketogenic diet. It does take some planning before the holiday, but we just had Halloween. Some of our families will be really creative and allow their child on the ketogenic diet to go trick-or-treating, and maybe the Wicked Witch comes and steals all the candy. They leave the candy wrappers around the house, and then the parent will leave a toy for the child when they wake up. And so there's creative ways to incorporate your child into the holidays. There's gingerbread recipes, there's birthday cake recipes that will fall under the ketogenic diet principles. You can eat pizza with your family. This is a delicious ketogenic pizza using almond flour as the base, eggs, and mozzarella cheese. Has the same texture. I prepared this for a potluck, and everyone enjoyed it and didn't even know that it was keto friendly. So I really do encourage my families, if the child's on a classic ketogenic diet, that they also serve the same food components as what the child's having, to really include them into the meal times. You can consume fat in fun and creative ways. It's not just having the oil or the butter on your plate. You can be really creative. And so you might have heard the term fat bombs. They're pretty popular. This is just using coconut oil and using stevia as a carbohydrate-free sweetener. And we have some chocolate ones here using unsweetened cocoa powder, or you can do like a strawberries and cream pictured here. And so this is something where you can have your protein and you can have your carbohydrate as your meal, and then this is a vehicle to get your fat in. You can still go to McDonald's. So you can be as creative with the time that you have. You can be as basic as a hot dog, some cheese, and some mayonnaise with ketchup, or you can spend time making creative recipes where this mom she wanted to include her son because she had a daughter that went to McDonald's and got the toy, and so she really wanted to include him in that experience. So we made a ketogenic recipe for the chicken nuggets, and we reserved the carbohydrate for the fries, and then he was still able to go and order at McDonald's and get his toy and be included in that family meal. Ketogenic kids can still eat carbs or their version of carbohydrates. There's many recipes out there for muffins and pancakes and waffles using lower flour alternatives such as almond flour or coconut flour. And you can make the diet culturally appropriate. The ketogenic diet is actually practiced globally, and so there's many recipes that are ethnically based to include with your families, with whatever diets that they practice at home. Today, the diet is much easier to implement than it was 5 or 10 years ago. As you probably have realized, that the ketogenic diet is very popular in the adult world for weight loss, and so this has really driven retail and manufacturers to start developing low-carb products. And so I'm sure, as Jessica was talking about, the Mission tortillas, so they make a low-carb tortilla. You don't even have to go to a specialty store anymore to get these. You can find them at Ralph's or Albertsons, just your local grocery store. I'm sure all of you guys have seen the spiralized vegetables that are in your frozen aisle in the grocery store. Or crunchy cheese. So if you think being on the ketogenic diet, you're missing out on those chips and those crackers, and this is a great way to get that crunch back into your diet. So many, many products. There's also medical foods that you can purchase with the help of your dietitian. There's donuts, there's pizza, there's breads, and different products that you can purchase through some of the formula companies that specialize in the ketogenic diets. So when would we consider the ketogenic diet as a therapeutic option for your child? Well, we know that taking a pill is much easier than changing the whole diet of your child. And we also know that medications the first appropriately trialed medication will be 50% successful in controlling seizures. The second, either combination or drug tried after that first one, we know is only about 10 to 15% successful in controlling seizures. And so the diet, and as you can see, the third and greater than the third trial, you can see it gets smaller and smaller, the efficacy of controlling seizures. And so the diet really should be considered for that 1/3 of uncontrolled or non-responders to medication. So typically, most practitioners will practice after 2 to 3 medications have been tried and failed that the ketogenic diet should be an option for that child. There was a consensus statement actually just published, an update last year in 2018, and this was a group of experts internationally looking at the current literature of the efficacy of the ketogenic diet. And what we know, they published a report 10 years ago, and what we know now is very different. And so they were able to categorize the efficacy of the diet as, and what we consider effective is greater than 50% reduction in seizures. And that's what they're considering effective. And so they were able to categorize in table 1 children that had greater than 70% response rate, and then in table 2 candidates that had about a 50% response rate to the diet. And so depending on the diagnosis or the seizure type that your child has, the diet might be more effective with table 1 than table 2. However, it's not to say that we wouldn't trial the diet with children that have things such as Rett syndrome or absence seizures. That would be something we would still try, but things such as infantile spasms or Dravet syndrome might be more efficacious. Now, it's very important to do pre-screening. This is a medical nutrition therapy done under medical supervision, and we do require laboratory work to screen patients to make sure if we're putting them on a high-fat diet, we need to make sure that they can tolerate and metabolize high-fat diets. And so there's a number of different labs that we have to obtain to medically clear these children to be able to go onto the diet. And so looking at the efficacy, we typically will break it down into what we call the rule of thirds. So the diet is effective, 1/3 of patients will have greater than 90% reduction in seizures, with about half of those, or 10 to 15%, becoming actually seizure-free on the ketogenic diet. 1/3 will have greater than 50% reduction in their seizures. And remember that 50% is what is that cutoff point of what we term effective. And then 1/3, either they don't see quite that seizure response, or families will feel like the diet is too much of a lifestyle change to maintain over the long term. So the million-dollar question that I get all the time is, when will I see if this is effective? When will this work? And there was a research study done out of Johns Hopkins looking at patients that were responders to the diet. And so this is a cohort of about 100 patients that responded to the diet, showing when they first saw their first sign in seizure reduction. And so as you can see, at about 1 week, 50% had reduction. So these are all patients that will have responded to the diet. So about 1 week, half of them responded. In about 2 weeks, 75% were responders, and then 100% responded to the diet in 2 months. So I usually tell my families it's very individualized, but by 2 months, we should see if your child's going to respond to the diet. That should occur within that 2-month period. With that said, there are some variabilities where we have multiple tools in our toolbox to try to maximize the effectiveness of the diet. And so certain things like medications contain carbohydrate. And so if we weren't accounting for that, maybe the diet wasn't effective because we were getting unknown sources of carbohydrate. And so generally speaking, most centers will say, give us a 3 to 6 month commitment of the diet to see if it's effective, because we might need to tweak and change and modify to get that seizure control.
And to actually piggyback on what Jessica just mentioned, it made me think of one of my patients who we do ask for about a 3 to 6 month commitment on the diet, but I had a 20-month-old on the diet, and we didn't see any changes in his seizures until around 5 months. But the family was pretty motivated and wanted to continue that, which is why we opted to do that, and it showed benefit for him in the long term. So moving on to vitamin and mineral supplementation, as you noted in the previous slides, this is a very restrictive diet. And so a study took a look at conducted a micronutrient analysis of several different variations of the ketogenic diet, ranging from a 1-to-1, 2-to-1, 3-to-1, 4-to-1 ratio. And so with the highest, most strict ratio, they only found that 3 of the 28 dietary reference intakes, so that's the recommended amount of certain micronutrients, they only found 3 of the 28 that were assessed actually were met on the highest ratio. Even on the least restrictive, a 1-to-1 ketogenic ratio, which also encompasses the modified Atkins diet, the low glycemic index treatment, and the medium chain triglyceride diet, that less than half of the DRIs were met as well. So in general, because this is a very restrictive diet, we always recommend a comprehensive multivitamin and mineral supplement. So that can be, typically we recommend a Centrum tablet. And for young children, because a lot of those supplements for children tend to be, they can be liquid, they can be gummies, they tend to be kind of sweet. They too have carbohydrates in them, surprisingly, and we want for these children to maximize their carbohydrate intake from food to make it more palatable and whatnot. So sometimes we'll recommend a half Centrum. For adults, we'll recommend an entire Centrum. We'll also recommend a calcium and vitamin D, as well as a phosphorus and potassium supplements, and this is to maximize bone health, for which both anti-epileptic medications and the diet have been known to impact bone health. So that's just to kind of cover our basis for micronutrients. As we mentioned previously, there are hidden sources of carbohydrates. Essentially, anything that you read on a nutrition label that says OSE, O-S-E, is a carbohydrate. So dextrose, sucralose. There are some more obscure ones like glycerin, sorbitol, xylitol. Those are all hidden sources of carbohydrates. And so if a label says sugar-free, it doesn't necessarily mean carbohydrate-free, because it will have some of those ingredients in there. Some additional hidden sources of carbohydrates could be toothpaste, chapstick, medications. Essentially, my general rule of thumb is anything that someone can swallow that has a source of carbohydrates can maybe influence a diet. So if we're doing things really well and we can't necessarily figure out what it is, we might go dig a little deeper into the toothpaste and whatnot. Because children's toothpaste, I remember when I was really young, I liked the Crest Sparkle toothpaste. It was super sweet. And that's because it had those hidden sugars, hidden carbohydrates in them. So again, like I mentioned in the previous slide, vitamins and minerals can also have hidden sources of carbohydrates. So something that we dietitians can definitely work with you is trying to find the right combination to make it easy for your child to take these supplements on a regular basis. Like most therapies, this doesn't come without side effects, but I do want to say that these side effects can be prevented and they are monitored very carefully. So the main side effects that we see, the primary one is constipation, and that's because fat, what it generally does, it's a high-fat diet, it slows every single thing in the body. So because it's slower, we might just be a little bit more constipated. Metabolic acidosis, that basically means that the acid in our blood is elevated a little bit, and that can sometimes not be good for our bone health. In addition to, it can also increase the risk for kidney stones. So we do check labs every 3 months in children and adults who are on ketogenic diet therapies, and there are certain labs that we do monitor for metabolic acidosis and kidney stones. If you are shown to have metabolic acidosis, there's another vitamin we can recommend to help essentially buffer the acidosis and have your blood go to a normal pH. Last but not least is hyperlipidemia. In my practice, I haven't necessarily seen this much, except for individuals who tend to eat a lot more red meat versus lean proteins. Essentially, this is something we monitor every few months as well. Last but not least, that's not mentioned here, is I've had some patients experience reflux on this diet. And again, that's because just like constipation, everything slows down when you eat a high-fat diet. So it sits in your stomach a little bit more, which can cause some pain every once in a while in some individuals. So how do we monitor a child on diet therapy? As I mentioned in the last slide, we do check labs every 1 to 3 months. At home, we would teach you how to check urinary ketones. So essentially that tells us, is the diet doing what we think it's supposed to do? And that's a way for you to check at home. We, dietitians and neurology, would follow up again every 3 months, and we would take a look at growth, tolerability. We would ask about constipation. In the long term, we might check a renal ultrasound. In my center, we check that about once a year after you've started the diet, and that's just to monitor, aside from labs, to see if there are any kidney stones. We'll also get an echocardiogram of the heart, just for monitoring your cardiovascular system. Now you might think, why did we leave this slide blank? That was definitely on purpose. A big question that we get when children and adults start on this diet is, will my child wean off medications? And as you can see, we don't have a direct answer for that. That obviously is a huge goal of ours, is to hopefully wean off medications. But again, the diet, just like some medications, unfortunately we cannot predict whether it will work or not and what combination it will. So something that we will discuss in nutrition, in neurology, with your neurologist, is how you would wean off medications. And typically that's discussed at 3 to 6 months and based on the efficacy of the diet. I would always recommend for you to bring that conversation up to your neurologist, because I think that they too would be highly motivated for trying to wean off some medications. And what about the diet? When do we wean off the diet? There are 3 reasons why we might wean off the diet. The first is if it's inefficacious, if it doesn't work. And typically we would have quite a swift wean just about after 3-4 months on the diet. If the diet is efficacious, anywhere between 18 to 24 months on the diet, we might try a slow, gradual wean, just like you might taper off a medication. And that's because we don't want to cause any adverse events, such as breakthrough seizures when we do that. Other reasons we might discontinue the diet is noncompliance, or if there are any serious complications, such as pancreatitis, fractures. I had someone who had severe GI, gastrointestinal issues on the diet, and we had to discontinue it as well for those reasons. So what resources and tools might help you in this venture? Not only are neurologists and dietitians at your aid, but there are some apps that can be very helpful. I really like the app Carb Manager. You can, with your dietitian or independently, you can set this up to count net carbohydrates. The Charlie Foundation, they're essentially the ones who brought the ketogenic diet back to life in the 1990s and have been responsible for actually my institution. They helped bring it to the University of Southern California. They've been instrumental in educating dietitians and families for 25 years, I think. They have excellent resources, recipes on their website, in addition to other information on other applications of the ketogenic diet. I am not familiar with Chronometer.
Yeah.
Thank you.
Chronometer is similar to Carb Manager. It's another app that you can use, or it's web-based, where you can set up your macros and count your net carbohydrates, including tracking your fat and your protein goals.
And something I love about these sessions is it's not only you guys getting information, we also learn a bit more. So I'm excited to check that website out. Keto Diet Calculator. The Charlie Foundation helps sponsors this website, and this is that food database. It's a medication database that we dietitians use and that we can provide recipes to families on the classic ketogenic diet. At your center, your dietitian can also provide you access to create meals for your child too. So if you're on the classic ketogenic diet, you can be the one instrumenting and being proactive about recipe development as well. There are lots of modified Atkins diet recipes available. And I really like some of these books. The Ketogenic and Modified Atkins Diet Treatments for Epilepsies and Other Disorders, that's like essentially the Bible, I feel like, of ketogenic diet therapies for epilepsy. It has kind of everything you need to know, not only about the evidence behind the ketogenic diet, but how to apply it, in addition to some recipes and other resources. The Fat Bombs book, Jessica mentioned previously on different fat bombs you can make. There's a lot more available in that book. And Quick Keto in 30 minutes or less is an excellent resource because we all lead very, very busy lives. And so a recipe book like that can be very helpful in preparing quick meals for you and your family, especially if you're on a liberalized diet. All of that said, we know the ketogenic diet is very popular right now, and so I did a little research of my own. So if you Googled ketogenic diet cookbook in Amazon, and this was a few months ago, but I got over 2,000 hits for Amazon ketogenic diet cookbooks. And when I Googled ketogenic diet recipes, I got over 769,000 recipes. There's a lot of information out there, and even for someone who practices this with patients, it can be very overwhelming with the information. Very useful, but it can be overwhelming. So some of these recipes can be very helpful. So Alana's Pantry does have a ketogenic diet section in there, and this keto brownies made with macadamia nuts, some dark chocolate, coconut oil, actually, as you can see, I calculated it out, has a quite high ketogenic ratio at a 2.3 to 1, with about 2.5 grams of carbohydrates per brownie. That's pretty good. So some recipes out there are great. I found this recipe in a book that is called Simply Keto, and it is lime Brussels sprout chips. And unfortunately, this is not high enough in fat. As you can see, the ketogenic ratio is 0.5 to 1. So something I definitely recommend is using your resources and just connecting with your dietitian and being like, hey, do I have the thumbs up for this? Can you take a look at this for me? Because we can easily adapt these recipes if this is something that you're interested in. We just want to make sure that you guys have the right information to implement this correctly at home. Last but not least, there are a lot of products out there or recipes. What is that called? Blue Apron. This one's called Green Chef, where you can get sent ingredients to your house and then prepare meals autonomously. I love this idea. Unfortunately, sometimes for the extent of ketogenic diet therapies for our patients with epilepsy, it might not meet the mark. So in this case, this is called a turmeric spice chicken, and as you can see, very, very small, under the menu it says keto, paleo, gluten-free. Unfortunately, it's a 0.2 to 1 ketogenic ratio. So we can make adjustments again to this meal, but the total I don't know if we could to this one. The total carbohydrates are 26 grams and the dietary fiber is 9. So per serving, this would be about 15 grams of carbohydrates, which is quite high for the diet. So just something to be aware of. There's a lot of information out there, and it's very important to vet it. But again, contact your dietitian. We are more than happy to be of assistance and help navigate that for you. That said, I want to say thank you, and I realize that was a lot of information. So if you guys have any questions for Jessica and Jessica, we're more than happy to answer. Oh, yes.
Could you put this slide up? I think I missed it at the beginning.
Yes. Do you need an explanation of the ratios again? Go ahead, Jess. I'll find it, maybe.
Okay. Something I didn't mention earlier is, as Jessica was alluding to, we, as dietitians, definitely individualize all the therapies for each individual patient that we're treating. And so with the ratio, we typically, for oral feeders that are going to be on food, we try to stick to the lower ratios because, as you could see in this picture, you have much more volume of food. I'll go back, don't worry. You get much more volume of food on the lower ratios, and so it's going to be more palatable, it's going to be more sustainable. And so if we can achieve the seizure control that we're looking for on a lower ratio, that's what we want to do. Now for a tube-fed patient, and it's not going to change the quality of life, and if they're tolerating the higher ratios, the formulas come in a 4-to-1 ratio, and so it's just easier for the family and for the preparation to go up to those higher ratios. We also track ketones in the blood sugar and the acid-base balance that Jessica was talking about. And so we advance the ratios. I have had patients where I've stopped at a 2-to-1 because their ketones are in the therapeutic range. I've had patients where I'm at a 4-to-1 and they're not quite in the therapeutic range. So it's very individualized, and we have to make adjustments according to how the patient is responding. But the ratio, the way it's calculated, is you have 4 grams. At a 4-to-1 ratio, you have 4 grams of fat to every 1 gram of carb plus protein. So that would provide you 90% of your calories from fat at the 4-to-1 ratio, which is typically the highest prescribed. Does that answer your question? So the way that we calculate it isn't necessarily percentage of calories, because we always need to make sure we're meeting the protein needs of the child. And so depending on what calorie level we estimate them at, we calculate the grams of fat, and then on the grams of carb plus protein, we meet their protein needs, and then whatever is remaining is their carbohydrate. Any other questions? Yes.
Yes, there are hidden carbohydrates. It's amazing how much carbohydrates are in everything. Now that's something that we dietitians have in a database. We have a database of medications and vitamins and minerals that we can help navigate that for you. It's nearly impossible to not have something with some carbohydrates in it. Our general rule of thumb is to make sure that medications and vitamins or minerals overall are less than 1 gram of carbohydrates. So when you work with a dietitian, we can help figure that out for you, and we obviously work with the neurologist to make any adjustments in medications that might have a lot of carbohydrates in them. If we are unable to make those type of adjustments, because I have had some patients who just would not take, the different form, we would make adjustments in their meal plan to accommodate for those carbohydrates. Mm-hmm. Mm-hmm.
Yeah, so general rule of thumb too, liquids contain carbohydrate, tablets contain much less carbohydrate. And so most often we're switching all of the medications to a tablet form, and then our pharmacist will help dose the correct amount appropriately. So you'll be dissolving that tablet in water and then drawing up a certain ml amount to be equivalent to your current liquid dose. Mm-hmm. So probiotics do contain carbohydrate. Like the children's packets, they flavor them. They're sweetened to taste good so that they take it. But if you do an adult capsule, you can open up the capsule and provide it that way. It will reduce the carbohydrate significantly. So there's definitely resources and options we have to make modifications to reduce that carbohydrate load.
Is there any danger to
not sure if there's any, so just to make sure I understand your question correctly, so if your seizures are well controlled on medications, is there a danger in doing the diet on top of that? In attempt to, I'm making an assumption here, in attempt to reduce medication burden? Or just
And just to further enhance
the therapeutic?
reduce the chance of future seizures, that sort of thing.
I can't necessarily say, it is probably not dangerous by any means. I've had some adult patients whose seizures were well controlled on medications, but they didn't want to, they had a large medication burden. And so we trialed the diet, and they were able to make some adjustments. We don't have guidelines for that, so my recommendation is if that's something you choose, to work closely with a dietitian and your neurologist. I wish we could predict this a bit more, but like we all could, but to work closely with someone to help you navigate that.
If you, obviously for younger children, sometimes it's a little harder to get them to follow this. If you have someone that's not having frequent seizures, maybe once a month, is this something you'd still recommend, or is it something that's maybe not as needed, I guess?
Yeah, that's a great question, and I think that really is a discussion to have with your medical providers, as well as you being, part of that discussion and what the family desires. Some families, one seizure a month is too many, where other families feel comfortable with having that frequency, and so it's just weighing the risks and benefits.
Yeah, I mean, it's not really, I just wanted to know if you think it would make a difference. I mean, do you see examples of kids that have that type of frequency that where the keto diet makes it go down to even once every 3 months or
Yeah.
some kind of difference?
We have patients that we've started on the diet that have been effective with that frequency.
And something, I apologize, I wanted to add to that. So something else we talk about in our clinic as far as frequency of seizures and diet efficacy is, and even for medications as well, we like to see, I think he calls it the rules of 3. There's lots of rules of 3. But if you, forget the rules of 3, but if you can see, so let's say you have a seizure once a month. If you don't have a seizure for 3 months based on that, the neurologist I work for considers that a significant change in seizure burden. Or let's say if you have a seizure once a week, if it gets reduced to 1 seizure every 3 weeks, that would be a significant change. Now that said, because it takes about 3 months to see if the diet works in someone who, I'm not saying that it's not worth it. We've had several patients start the diet with 1 seizure a month, but it might take a longer time to see the diet work. So it would, again, it would have to be a discussion for you and be right for you and your family at the right time. I apologize, I interrupted.
My question is based on, I know the talk was mainly based in children, but is there a correlation as the person with epilepsy is older, or is it pretty linear across the board?
The diet works for adults just as it works for children, and that's something, a good note for us to continue to work on in these presentations is to make sure that we address the adult population as well, because it does, I work with an adult population, and I think the most challenging for the adult population, not that it doesn't work, is that we're adults, lifestyle change is really hard because we've had so many more years of trying things that we enjoy and we have our life, and so it's different, but the efficacy remains the same as far as adults.
And just one thing to add to that, the oldest patient, or the longest duration that I know of, Johns Hopkins does adult patients as well, and I think they have a patient that's been on the diet for 40 years.
Yeah.
And again, for adults, you're going to be doing more of the liberalized form, so more of the modified Atkins diets where you can go to work and go out with your friends and whatnot and travel and make the diet successful.
My recommendation for adults is, at least I know for if if it were I doing something like this, is to make small baby steps towards it, because that sustainability aspect, that's what's important on this diet, is making sure that it's sustainable for you. So if you're an adult and you, like most of us, lead busy lives and trying to fit it in, making small steps one at a time is a good method. Uh-huh.
You have to sort of go all in to get results. I mean, can't just an increase in healthy fats help, say, someone with seizures. I mean, you have to get the ketosis to listen to.
Yeah, no, great question. So the different forms, that umbrella that Jessica was showing, is that there are different types of liberalized forms of the ketogenic diet. And so something like the low glycemic index treatment, or LGIT treatment, is actually, it's still a high-fat diet, but maybe about 70% or 60, 70% of your calories are coming from fat. And then you get more carbohydrate. And the point of that diet isn't to get into ketosis, but it is to maintain a stable level of blood sugar. So right now in an American diet, our blood sugar, peaks after eating and then drops when we fast. And so we have a very roller coaster blood sugar. And so on the low glycemic index treatment, what is thought to be the therapeutic seizure control mechanism behind that diet is a stabilized blood sugar. With that said, for the classic and the modified Atkins ketogenic diet, you do have to have that carb restriction. Your body will not produce ketone bodies without carbohydrate restriction.
And I want to answer your question, but just to piggyback on that, in my patient population, not everyone reaches ketosis to see therapeutic effects of the ketogenic diet. It's something that, in studies, they've suggested that ketosis doesn't always mean seizure control. But for some individuals, some people require really high ketosis to achieve seizure control. So again, it's a dose response. We don't fully understand it yet. I know it's something that's being thoroughly discussed in our groups. I'll take one last question, then we'd have the gentleman. We'll be in the back if later.
You had mentioned how somebody differences in when they respond from 1 week to 5 months, like you mentioned, out to like a year. I'm just curious, in between, are you making changes and then that's when you see on the or is it staying the same?
In that one patient who it took 5 months, I actually didn't change anything. Typically, yeah, it was a strange case. Typically, we would make some adjustments. For instance, let's say that they're on a ratio, a 2-to-1 ratio, but we're not seeing good ketosis and we're not seeing good seizure control. We might push them up a bit. It's definitely dependent on the situation. Thank you all. If you have a couple more questions, we'll be in the back.